Thank you for joining us today. Whether you are turning 65 or have been working and remained on employer coverage, you likely have a lot of questions about Medicare. I'm going to attempt to answer them all. I'm Becky Jennings. I've been working in the Medicare space for about 20 years, so I've definitely seen some changes. My goal is to guide you through the process so that when you get to the other side, you are confident in your healthcare decisions. Neither Jennings Insurance Group nor I are affiliated or endorsed by any government entity. I am providing you with general information for educational purposes. At the end of the presentation, if you would like, we can schedule a one-on-one appointment to discuss your specific needs or concerns. When folks are becoming eligible for Medicare, it's often accompanied by retirement. Our firm can help guide you through several aspects of the decisions you are making as you transition into retirement. We do that by helping you account for the 5 risks of retirement. The first one, healthcare. Can I get and afford the healthcare I need? Longevity. Will my money last as long as I need it to? Taxes. Income strategies should include accounting for future taxes, but also strategizing to potentially lower tax burdens. Inflation is often referred to as the silent killer for financial planning. And remember when 4 loaves of bread cost $1 and now 1 loaf of bread is $4? That's inflation. Market volatility. What is your risk tolerance? How much of your savings is at risk in the market? And are you comfortable with potentially losing a portion of those dollars? Today's topic is healthcare, specifically Medicare. Who is eligible for Medicare? Well, typically, if you are 65 or older, or if you have certain disabilities, you may be eligible for Medicare. In most circumstances, you would need to be disabled for 2 years before Medicare kicks in. But with certain disabilities, you may be eligible sooner. We often get asked the first thing, how to sign up for Medicare. If you are taking Social Security when you turn 65, you are typically automatically enrolled. If you have not started Social Security, you need to take action by signing up for Medicare through Social Security. You will want to begin this process a couple of months before turning 65, and it can take a few weeks to actually get your Medicare ID number. Often, folks think Medicare is free. It isn't. There are 2 parts of Medicare, which I'll explain shortly, but the first thing you need to know is Part A and B. Those are the 2 parts of Medicare that we'll discuss first. And if you worked the required number of quarters, you may pay 0 for your Medicare Part A. But your Part B generally has a premium. So you have actually been paying for Medicare your entire life through payroll. There are 3 ways to pay your Medicare premium. First, if you're taking Social Security, it will automatically be deducted each month from your Social Security check. If you're not taking Social Security, you will either be billed quarterly or you can set up an auto draft through Social Security. It's important to know what Medicare does not cover. Medicare doesn't cover prescriptions, routine dental, routine vision, hearing, long-term care, and care outside of the U.S., except in very limited circumstances near the border, or alternative care. Often people are surprised by this, but these are all important considerations when deciding on care beyond what Medicare covers. The Medicare alphabet. Let's get into it. When you receive your red, white, and blue card, you will see Part A, hospitalization, and next to that is a date. You will see Part B, medical, and with a date next to it as well. The dates are merely the date that part started. An important piece of information here, a lot of times folks are looking for an actual card in the mail that looks like an insurance card. That is not what you'll receive. In fact, if you do get that, that is a scam and it's not your actual card. The card you receive will come as perforated cardstock, and it is often missed and tossed in a pile or in the trash, so be on the lookout. What does Part A cover? Part A covers 4 things. First, it covers inpatient hospital stays, but only the facility. So things like doctor services and your slipper socks, they're not covered under Part A. You will have to pay your Part A deductible when you are hospitalized. Then daily copays if you're hospitalized for an extended period of time. Skilled nursing facility. After you've been hospitalized as an inpatient for 3 days, You may qualify for skilled nursing facility stays while you are recovering. Medicare covers the first 20 days, and then you're responsible for a set daily copay amount up to 100 days for a benefit period. Home health care is covered 100%, but be careful. You will need to understand if the care you're actually receiving is covered by Medicare Part A. And number 4, hospice. Hospice is also covered under Medicare Part A. Part B of Medicare covers things like outpatient, emergency room, durable medical equipment, x-rays, labs, those doctor services when you're hospitalized, office visits, physical therapy, etc. Every year, Medicare determines your Part B deductible, and once that is paid, Medicare pays 80% of Part B care. You do not have a maximum out-of-pocket on Part B, so you're responsible for 20% with no cap on your cost. Preventive is also covered under Part B at 100%, so things like your wellness exam, flu shot, and pneumonia shot, etc. are covered 100% under Part B. Before we go any further with the alphabet, you'll want to know there are a couple of acronyms that might be important for you to know. IRMA and COLA. Both are determined by Social Security. About 8% of Medicare beneficiaries are affected by IRMA, which is the Income-Related Monthly Adjustment Amount. Here's what that means. While most people pay the standard Part B premium, folks considered high-income earners by Social Security may be subject to higher monthly premiums. The income they consider is your household income from 2 years prior. In other words, for 2026, they'll look at your income from 2024. Social Security will send you a determination letter explaining the higher premium. And if you have had a drop in income due to specific circumstances, like no longer working, you can file an appeal using the Social Security form. COLA is the cost of living adjustment, also determined by Social Security. Simply put, when Social Security increases, your Medicare Part B premium also increases. The good news is there is a hold harmless provision. This means your Social Security check cannot decrease because Medicare premiums increase. The Part B premium increase is limited to match the COLA amount, preventing a benefit reduction. This typically applies to people who do not have IRMA and for those currently taking Social Security. While I know C comes after B, I'm going to skip to Part D. D for drugs. This is referring to your prescription coverage, and there are several things you will want to know about prescription coverage on Medicare. Part D is not offered by Medicare. In fact, you must get Part D from an insurance company with a Medicare contract. Part D plans have a few requirements. They must adhere to Medicare's requirements, but they can enhance those benefits. These plans may have a monthly premium, which can be deducted from your Social Security check. Sometimes, folks who don't have prescriptions do not feel the need to enroll in a prescription plan. Please note, there is a penalty if you do not enroll in Part D and do not keep creditable coverage like with your employer, and I'll discuss this shortly. Let's start with some of the requirements the plans adhere to. Each plan has a formulary, which is a list of prescriptions covered under the plan. Each prescription is placed in a tier, usually Tier 1 to Tier 5. Tier 1 and 2 are typically generics. Tier 3 and 4 are typically name brand drugs, and Tier 5 is typically specialty. I say typically because sometimes a generic might be found in a Tier 3 or something like that. But generally speaking, that's how the tiers work. The insurance companies can determine what tier a given drug is in. For example, you may have a generic drug in one plan that's considered a Tier 1. The next plan, it might be a Tier 2, and in the third plan, it might not be covered at all. And these plans change every year. The plans can have a deductible, which is determined each year by Medicare, along with a cap on how much you pay for your covered prescriptions. These plans can change each year on January 1st, so it's important to make your plan selection during the annual enrollment period, October 15th through December 7th every year. It's important to note, if you remain on your employer coverage, it must be considered creditable coverage by Medicare to avoid late enrollment penalties later. But if you decide you do not want prescription coverage when you are first eligible and you do not have creditable coverage elsewhere, later when you decide to enroll, You may be limited to when you can get a plan, and you will likely pay a penalty every month for the months you went without coverage. The late enrollment penalty is 1% of the average cost of a drug plan, and it continues to accumulate as long as you go without coverage. For example, let's say the average cost of a drug plan is $40 per month. And remember, this is just an example. These are not real numbers. The late enrollment penalty in this example is 40 cents per month. If you go for 10 months without your drug coverage, your penalty is $4. That means you will pay an additional $4 every month when you enroll. And remember, this is merely an example, not a real number. Social Security determines if you will have a late enrollment penalty and the amount of said penalty. It's a good idea to make sure you have a creditable prescription plan when you become eligible for Medicare to avoid those late enrollment penalties. There is a total yearly out-of-pocket cap on prescriptions covered by your plan. That means if you pay your deductible and copays at the pharmacy or through your mail order pharmacy, there is a cap on how much you will pay. Non-prescription drugs or drugs not covered by your plan do not count toward that cap. So using a coupon, for example, may have a negative impact on how much you pay for the year. Check with your plan and your pharmacist for tips on how to maximize your benefits. I'm going to skip a few more letters and talk about Medicare supplement plans, also known as Medigap plans. And you may have heard of Plan G or Plan N, for example. These plans are not covered by Medicare. These plans are offered also by private insurance companies who have a contract with Medicare. Medicare determines how these plans coordinate with Medicare Part A and Part B, and these plans do not cover prescriptions typically that are covered under Part D. So to have prescription coverage, you will need to purchase an additional plan. Here's a few things to know about Medicare supplement plans. These plans pay secondary to Medicare. In other words, if Medicare pays their portion of the claim, the Medicare supplement or Medigap plan must pay their agreed-on portion of the claim. They cannot deny coverage if Medicare paid. They have a monthly premium, which typically increases annually. You will pay your Medicare Part B deductible, and in some plans, a copay for certain benefits. Plans are standardized, so all plans with the same plan letter pay the same way, regardless of what insurance company you purchased it through. Typically, there is no network. They are guaranteed renewable as long as you pay your premiums. Underwriting is required except during the initial enrollment period or during certain special enrollment periods. There are no health questions if you are new to Medicare. Or you may choose to go with a Part C plan, also known as Medicare Advantage. These plans have a contract with the federal government as well. However, instead of paying alongside Medicare, they pay instead of Medicare. In other words, Medicare pays the Medicare Advantage plan to manage your claims. You must have Medicare A and B, and there is often no additional premium beyond your Medicare Part B premium. These plans have networks of providers. Many plans have prescription coverage, so you don't have to go buy another prescription plan, and it may require prior authorizations, and benefits do vary by plan. A few other things to be aware of. These plans require approval by Medicare each year, so benefits may change each year, so you'll want to review them. These plans are specific to the county you live in, so what is available to you in a certain county in Missouri may not be available in another county in Missouri. There is no underwriting or health questions. You are able to change Advantage plans during the annual enrollment period, October 15th through December 7th, or other times of the year if you qualify for special enrollment periods. I like to give two examples of clients. Let's talk about Patty. She's 86 years old, single, living on Social Security. She's had Medicare for over 20 years, so she's had claims like emergency room, hospital stays, surgery, and physical therapy. She wants a Medicare Advantage plan, and she understands what it means to have a network of doctors to choose from. She may have prior authorizations required for certain procedures. Her prescription plan is included. She knows she will have copays, but likes the safety net of her maximum out-of-pocket when she has claims. She feels this coverage is much like the coverage she had when she worked. And then let's take Bill and Barbara. They're 78 and 79 years old, and they want to be able to go to any doctor, anytime, anywhere. They are willing to pay a monthly premium, so they rarely get any bills. They buy an additional prescription plan and prefer their Medicare supplement plan in. If Bill and Barbara decide they want to move to a Medicare Advantage plan later, they can do so during certain times of the year and will not answer health questions. However, if Patty decides to leave her Medicare Advantage plan, she can go back to original Medicare, but will need to answer health questions if she applies for a Medicare supplement. When she answers the health questions, one of three things will happen. 1, she can answer no to all the health questions and is accepted into the plan. 2, she has a health condition that doesn't qualify her from getting a plan, but she pays a higher premium. Or 3, she is declined and may not qualify for a Medicare supplement plan due to a certain health condition. She can do this only during certain times of the year. Now let's switch gears for a minute and let's talk about delaying Medicare. Will you have a penalty? Well, that depends. If you have creditable coverage through an employer with more than 20 employees, you can delay your Medicare without a penalty. When you decide to apply for Medicare, you will need a form from your employer stating that you have been on creditable coverage in order to avoid the late enrollment penalty. You may decide to apply for Part A and delay Part B. If you decide that you do not want to enroll in Medicare and do not have creditable coverage, you can expect a penalty when you do sign up. The general enrollment period is January 1st through March 31st. If you delayed without having creditable coverage, this is when you can sign up. There is a 10% penalty added onto your Medicare premium for every year you did not have creditable coverage and did not have Medicare. As you can see, there are many things to contemplate on your Medicare journey. Making the right decisions, understanding the consequences, and reevaluating coverage annually are important considerations. So what's next? Start by answering these questions. Are you a candidate for delaying Medicare? If so, it's a good idea to compare your current coverage to Medicare coverage, including benefits, prescriptions, monthly costs, etc. If not, the next step is determining which coverage gives you peace of mind. Are you Patty? You want no or very little monthly premiums? You are okay with copays and networks? Or are you Bill and Barb? Monthly premiums give you peace of mind because you don't have networks and your copays are minimal. The very first step is deciding when you should apply for Medicare. Once you've applied for Medicare, then you will decide which way you want to go. You'll want to select what insurance company you want to use to add the additional benefits. It is important to consider working with a professional who understands all the moving parts and can help you along the way. With Jennings Insurance Group, you have an experienced team to guide and support you through the journey. We have 5 licensed agents who are trained and certified to help you. Additionally, we have 2 certified estate planners and support staff. When it comes to Medicare, you have choices. Thank you for choosing us. A great way to reach us is through our website. You can call us or send us an email.